I want to first welcome you all in the name of our incredible board and our incredible staff to Your Women's Fund Miami-Dade. As I always say, this is where we come together to put on our gender lens and focus on women and girls. If you don't hyper-focus on certain aspects of our society, you'll miss a lot. And that's what Your Women's Fund is very, very good at. Another thing we're good at is listening. There are going to be very diverse thoughts and opinions today, as many people are on this Impact Collaborative today, whether they're on screen or in the audience. We're going to have our own unique perspectives because everybody has a story, and that's the beautiful thing. That's what builds a strong community. So we're here to get educated, to hear other people's views, and to share. So let's go ahead, Kami. Let's see this incredible board. We have even some new board members. So you'll see Arthi there twice. Our board chair is going to be with us and helping us to welcome today. New board members, some of them are in the audience as well today. And we have some brand new board members, Ann Machado, Dr. Alex Cornelius from FIU, Bianca and Elise. Welcome to the Women's Fund Board. Incredible. On we go to think we do have some representatives and folks who are running for office who are here with us today. Politics are local. Thank you for your willingness to serve. Please do introduce yourselves in the chat. And thank you so much, community partners as well, for all that you do. Couldn't do this without fuel. So thank our donors, whether it's large or small. That's what fuels Your Women's Fund. And on we go to talking about our newest public awareness campaign. So we had one of our panelists today who's with us, Esther McCant, who also was with us at City Hall this week for the second annual National Heat Awareness Day launch of the pregnancy and health campaigns. It is critical and essential that all of us understand the duress that extreme heat is pressuring on pregnant people and our unborn and our newborns. Please do come to our website, get educated, and let's take care of one another. Now, I'd like to say that it's so beautiful that we all come together from so many different places, literally and figuratively, and we're honoring your precious time that you're dedicating to hyper-focus on women and girls. We're going to endeavor to give you great added value and to give you the confidence to be your own thought leaders and empowered advocates. And to help us center and focus the conversation for today, I warmly welcome our brilliant and amazing thought leader and board chair, Arthi Ramappa.
Thank you, Maria. I just want to say hello and thank you everyone for coming today and being a part of this Impact Collaborative. Before we begin, we understand that we just want to set the tone because we understand that this can be a very difficult and emotionally charged conversation. We understand people have other differing points of views and different opinions on reproductive freedom. We are not here to debate reproductive freedom. We're here to listen to what is going on in this space and to create awareness and education and to share. But with that, we want to acknowledge that we understand there are some people that have very emotional views about this, and we are not here to judge each other, even though we might have different points of views. We want to create a safe space where we are here listening and sharing, but even though we might disagree, we still keep the same respect and love that we have for one another, even though we might have different opinions. And with that, I want us to set the intent to have curiosity. And when we're listening to what's going on and to create, we're here at the Women's Fund, we're here to create awareness and advocacy on these issues. So this is a safe space where we're having the intent of curiosity, but we also want to make sure that we walk in all of our shared values of compassion, empathy, and kindness when we are speaking about this and speaking with each other. And I'm really happy for this conversation because it's very important in today's time. And thank you to all of our speakers for being here today. We appreciate you.
Thank you, Arthi. That leadership you carry through not only in this conversation, but all of them. So that's some of your values of your Women's Fund, folks. Thanks so much, Arthi. Speaking of values and leadership, we have the incredible privilege of pertaining as a Women's Fund to a great umbrella organization, which is really a membership organization of like-minded folks. So the Women's Funding Network actually helped to establish Your Women's Fund 3 decades ago. And our founder, Marilyn Gladstone, is especially happy that you are with us today, Elizabeth, because without the Women's Funding Network, we wouldn't have known how to get going here in Miami-Dade. So we're going to let you introduce yourself and focus us on this important topic today. Thank you so much for being here.
Thank you. Thank you, Maria. And thank you for inviting me. Can you hear me okay? Great. I was going to have some slides, but I think this is great because it's a town square. So I'm just going to start and we're going to forget about the slides for now. But again, thank you so much for joining us. And thank you for inviting me. Again, Elizabeth Barajas-Saman, President and CEO of the Women's Funding Network. And I just wanted to start with saying, just kind of it's early in the morning, kind of get everyone kind of moving. Raise your hand if you're pissed right now. If you're pissed about the impending setbacks that might be coming around reproductive rights. Okay, yes. All right. Raise your hand if, even though you knew this was coming or kind of had a sense that this was coming, it still feels a little unreal, like a bad dream. Right. Yeah. Okay. And once you raise your hand, if you feel that kind of sad, that the feeling that you're having right now is sadness, that we're in 2022 and that our daughters, our sisters, our nieces, and children of today will have to fight for the rights that their grandmothers thought they fought and won, and that's bringing a level of sadness to your feelings right now. Okay. Well, raise your hand if you're kind of a mix of all of these emotions and that together it kind of sets your feet on fire and you want to rush into action with everything you've got and it's just kind of coming together for you like that. Raise your hand if that's how you feel right now. Okay, great. Thank you. Me too. I'm right there with you. I'm the child of Mexican immigrants, and early in my career, I opened and directed a DC policy shop that was guided by the grassroots organizing of immigrant women in Texas and Florida. I saw firsthand how families gathered over food and music, and they wrote protest signs and wrote hundreds of letters to Congress about their reality. One where abortion was legal, but unavailable in ICE detention centers or not covered if they were on Medicaid. Many lived in unincorporated regions in South Texas where they were targeted by fake clinics. They encountered hospitals that used religion to refuse abortion care or even contraception. It was one of the proudest moments in my life to hand deliver dozens of boxes of letters written by these women, families, children, husbands, to congressional members, alongside a mix of those representing these badass Latinas from Texas and Florida. Again, it was just such an incredible moment for me at that level of organizing that was happening. And this is during a time we have right now where abortion is legal in those states, in the country. So after the past few weeks, where the leak of the Supreme Court draft opinion looks like it's going to overturn Roe v. Wade, I've cycled through all the emotions I started off with. It's no wonder that our feelings are kind of all over the place, and they're extreme right now because the stakes are so high. They say it's about life, and we know it is, right? We know that when life is uncertain, when housing, jobs, relationships, health challenges, even someone with a wanted pregnancy could be facing the difficult decision to end that pregnancy. So the right to abortion is not just its own singular issue. It's a civil rights issue. It's a public health issue. It's an economic issue. Abortion bans force women to give birth or to have an unsafe abortion. And forcing people to give birth against their will is emotionally traumatic and life-threatening. We know that. We know that not just anecdotally, but we know that because through research as well. The data shows that even when someone is denied an abortion, and even if they place that baby for adoption, they are still facing massive health care bills. In Florida, that bill can be up to $25,000, even with insurance, if that labor included a C-section or other complications. And we know that in the US, we have the highest maternal death rate in the world's developed nations. And with pregnancy and labor killing 700 pregnant people a year, and most of those women being women of color. With the majority of people who have had an abortion already have a child, already one or more children, we know that the most common reason for choosing an abortion is simply not being able to afford that child. The federal government estimates that the average cost of raising a child is well over $250,000. But all this doom and gloom is not why I'm here today. I'm here because I want to share what gives me hope. And I'm confident that we can restore if the decision is going to move in the direction we think it is. I'm confident that we can restore our rights, not in another 50 years, not in a generation, but maybe even as quickly as a few years. And here's why I believe that. Number one, we have the will of the people. It's incredible, but when we look at the data, it shows that the majority, over 60% of people in the US support upholding Roe v. Wade. We know that the rest of the world is also expanding abortion rights. We've seen historic progress in Ireland, Berlin, West Africa, and also in Mexico, where last year the Supreme Court ruled that criminalizing abortion is unconstitutional. We also have the power of each other. This is what gives me the most hope. 50 years ago, when Roe was passed, there weren't women's funds. Women's funds didn't exist. Now there are hundreds of women's funds all over the world. Women's funds are on every continent except for Antarctica. And women's funds like Miami-Dade move millions of dollars to grassroots organizations in our communities that organize and uplift the leadership of women and girls of color and gender expansive people. Even better, these women's funds are connected. This global network is an incredible asset to have, where we share money, power, best practices, and bright ideas. We've built trust and grown deeply connected over the past 50 years. And nothing can take that away from us because it is us. This time, we're better prepared to fight our battles. Nationally and in every state around the country, people with lived experiences are deeply integrated into our country's power structures. In 1973, women couldn't even have a bank account. And when Roe became law, there wasn't a single woman on the Supreme Court. Now we have Ketanji Brown Jackson, and we hopefully will add a fourth woman justice to the bench. In 1973, there were 16 women in Congress. Now there are 145, and Kamala Harris is serving as our first woman vice president, and Nancy Pelosi is our first woman speaker of the House. Having women in positions of power is not the only solution, but it's just to show that we have so much more going for us now than we did 50 years ago. Another tool in our arsenal is the learning from our history and evolving together to form a stronger coalition. In the past, the right for Roe and the suffrage movement for women's rights centered around the rights of white women at the expense of women of color. Women getting the right to vote really only meant white women, and women of color didn't get this right till many, many years later. But this time, we've learned from our past. We can do things differently. Together, we can build a more inclusive, stronger coalition because it's more, not because it's PC, because it's smart and it's effective. yeah, we can build, we can win temporary battles, and 50 years is a temporary battle. And I think this is what's showing us firsthand that when you leave people out, you do not create permanent shifts. Creating permanent shifts means every single one of us. And this includes men as well, cisgendered men as well. We saw this with the landmark win that's around equal pay of the U.S. professional soccer teams. Men's active participation in the quest for women's equality and equal rights, it just shows that we can be stronger now than we ever have been. Restoring and preserving our rights is the fight of our lifetime. And quite honestly, it probably will never quite be finished. But right now, with all these incredible forces of extremism, misogyny, racism, and violence, as we've seen over the past couple of weeks with gun violence, we know that to meet our goals, we need to be a coalition that doesn't leave anyone out. Winning is going to take all of us because we're stronger together. And honestly, that's what women's funds are all about. That's what women's funds are all about, and that's what our network of women's funds is all about. It takes all of us. And I'll just stop there by leaving you with an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. We have a long way to go, but I know that we can do it if we get there together. So now raise your hand if you'll join me. Thank you so much.
Stronger together, indeed, and better educated together, indeed. That's where we come here to the safe space, and we're here to share. So please, this is an interactive, live session that we're doing together. Please participate in the polls. If you're in the audience, post your questions in the Q&A. I'll try and grab them if they're in the chat too, but it's easier to find if they're in the Q&A. And please do feel free to share resources. This is your Central Plaza, and we're here together. We're here together. We did a really particular focus for this Impact Collaborative. We're looking at reproductive health. We're looking at reproductive justice. We're looking at reproductive rights, the definitions of those, the history of them, the legal repercussions of each, and trying to understand that it's not as simple as it looks, right? For us to understand will give us all our own empowered capacities to be the best possible advocates for what our own personal opinions are on these policies. So we are absolutely thrilled to have the amazing experts and voices here. Obviously, there's so many voices that could contribute to this conversation, but we've got some stellar leaders here who can help us to understand these issues better and next steps. So I will give each the impossible challenge of introducing themselves in 2 minutes or less within the context of our topic for today. And Professor Caroline Mala-Corbin, please take it away.
Hi, I am Caroline Mala-Corbin. I am a professor of law at the University of Miami School of Law. I specialize in constitutional law. One of the classes I taught last semester was advanced topics in reproductive rights. Although my specialty is First Amendment, I had my start at the ACLU Reproductive Freedom Project in New York City. And I often write about the clash between speech and reproduction, or religion and reproduction. And I have also written about the ridiculous theory of constitutional interpretation known as originalism. So I definitely incorporate concerns about reproductive rights and reproductive justice in my writing. I'm done.
Perfect. Dion Stevens, I won't call you doctor because we're not in the classroom.
Exactly. Thank you for doing that. So I'm Dion Stevens. I'm a professor of psychology at Florida International University. However, my background is in women's studies. My master's is in women's studies, and my undergrad was in humanities. So I have this sort of intersecting interdisciplinary lens towards my work. And my undergrad, I looked at, this was dating me now, in the early 90s, Blacks and HIV/AIDS, because I realized there wasn't a discussion happening then. And then my master's was looking at using zines for getting sexual health information out to the Black community. So it was about really connecting broadly. And then my PhD at the University of Georgia looked at the ways in which sexuality was being constructed around Black women in hip hop. So I've always looked at the ways in which meanings about sexual health are shaped within usually marginalized communities, and particularly the way it impacts women. And this is part of my larger interest in looking at within group differences, and also using an intersectional lens to look at how, even though I might be a Black woman, there's other layers to me that shapes my experiences and how I affect health. And most of my work focused on sexual health, which includes HPV, dating violence, all forms of intimate partner violence, and reproductive justice. So I think that's what brings me to the table as a feminist researcher doing this work from multiple positions.
Brilliant. Thank you for being with us. Diamond Delancey, thank you for being with us as well.
Thank you for having me. So yeah, my name is Diamond Delancey. My pronouns are she, her, hers, and I'm the Black Organizing Program Manager for Planned Parenthood Southeast North Florida. That is a mouthful, but Planned Parenthood is a very big organization, so I do want to specify. I come to this work as a low-income, first-generation college student. When I started, I'm born and raised in Brownsville, which is a subset of Liberty City from Miami, Florida. I tell people they probably see my neighborhood more times on First 48th than actually like experiencing the neighborhood, which is currently going under gentrification right now. I went to the University of Florida to get my bachelor's in public relations. I have my master's in forensic psychology from Arizona State University. And I come to this work as a queer Black woman who kind of realized that every intersection of my life, that my identity was being criminalized. And seeing how being a child protective services investigator in Georgia, they criminalized Black parenting and Black families under this like aspect of who is deemed a parent and who gets the right to parent and do that in a safe and healthy environment. So I am here with Planned Parenthood going through a reckoning of where we kind of stand with reproductive health, reproductive rights, and reproductive justice. And I come here with that lens. So that's me.
Thank you so much for being here. And Esther McCant, this is twice in 1 week. We had you working with us at the National Acute Awareness Day and protecting our pregnant people and babies. And thank you for your expertise there. And thank you for your expertise today. Please introduce yourself.
Hi, everyone. My name is Esther McCant. I am a Haitian American Miami native and University of Miami grad. I was on the pre-med bio major track, learned about the exorbitant amount of debt I'd go into if I pursued that route, and ended up starting my family after college. I served also with the Department of Children and Families Child Care Regulations Office. And now I currently serve my community as the CEO of Metro Miami Agency, where I help pregnant families find doula support or labor support. And I also provide postpartum doula support, helping them in the afterlife of all of the beautiful births that they might have experienced, and also help them with lactation and breastfeeding support. And since 2019, I've been mentoring new birth workers who want to get involved in improving maternal child health. Currently serving as the co-chair for the Healthy Baby Task Force, which is a subcommittee of the Consortium for a Healthier Miami-Dade Children's Issues Committee. And so we are a collaboration of different stakeholders who are tasked to reduce infant mortality here, increase health education, increase breastfeeding rates and the duration of breastfeeding, and also reduce HIV and STDs here in Miami-Dade County. Locally, we also have our Jasmine Project, which I'm also a part of as well, serving as the Community Action Network. And we serve the geographic locations such as Opelika, Miami Gardens, that tends to experience most of the infant deaths. And our work is to also try to reduce the risk of losing more Black and brown babies. And so my primary purpose right now, living 35 years young, is threefold. I'm here to exercise my right to choose and to seek out the joy, the pleasure, the self-love and self-care that I have often neglected as a result of being a mother of 4 children. I'm also here to hold other women accountable to do the same if that's what they desire with their birthing experiences. And so that means connecting them with doulas. And thirdly, I'm here to leave a legacy of raising 4 young men who will grow up to respect women and their rights. So thank you for having me today.
And thank you for your willingness to serve and to lead. Your Women's Fund is a part of that Healthy Babies Coalition and a Healthier Miami-Dade, just like we are of Domestic Violence Coalition and the Human Trafficking Coalition. It is so clear that we are indeed stronger together, and these perspectives are priceless. So now we're going to ask each of our panelists to focus us in 3 minutes or less on what you are seeing at this time. What do we need to know in your specific area? Caroline.
If I could have my slideshow begin, that would be super. I view my role basically as giving you the legal backdrop on what's going on in terms of the legality of abortion. So I'll be addressing both abortion at the federal level and also in Florida. So if we could go to, can you see the slides? I'm sorry, I don't know if they're up. Yes, okay. Slide number 2, summary of abortion law today. This is federal abortion law. This is the law that's going to vanish, but you should at least know what we're losing. So there are basically 3 main rules for abortion law today. The first is the state may ban abortion after viability. Viability, as you probably know, is the point at which the pregnancy can survive outside the uterus. It's approximately 24 weeks. So after 24 weeks, it is currently constitutional to ban abortion, though there has to be exception if the woman is going to be jeopardized in some way. Before viability, however, the state may not ban abortion. So the current rule is pre-viability abortion bans violate the US Constitution. States can regulate abortion, but if they do, they can't impose an undue burden on women. They can't impose such a substantial obstacle in her path that she really just can't get an abortion. Okay, that's all going to change, unfortunately, because of the case before the Supreme Court. Now, this is Dobbs versus Jackson Women's Health Organization. Mississippi passed a law that banned abortion at 15 weeks. This is clearly way before viability. It is also clearly unconstitutional given the rule that pre-viability abortion bans violate the US Constitution. And indeed, that is both what the district court and the Court of Appeals held. This 15-week ban violates the US Constitution. It's actually a very straightforward case as a matter of constitutional law. So it was of great concern when the Supreme Court decided to hear the case because of the fear that they were going to overrule Roe v. Wade. And as we saw from Alito's draft, that is indeed what's at risk. So the Supreme Court is on track, and I'm on slide 4. The Supreme Court is on track to hold that the US Constitution does not protect the right to abortion. In other words, it will overrule Roe v. Wade, the case that established the right. This does not mean that abortion becomes illegal everywhere overnight. What it does mean is that each state can decide for itself whether it will protect abortion rights or whether it will make abortion illegal. Florida is clearly on track to make it, if not illegal, at least it's following in Mississippi's footsteps by enacting a law that bans abortion at 15 weeks. So this law has already been passed and signed. It goes into effect July 1st. And that is not the end of my story, because here's the twist. Florida has in its constitution an explicit right to privacy. And I put it up, right of privacy. Every natural person has the right to be let alone and free from governmental intrusion into the person's private life. And obviously, what is a greater governmental intrusion into somebody's life than being forced to be pregnant against your will? And indeed, the Florida Supreme Court has held that this right to privacy protects abortion. So even when the Supreme Court overrules Roe v. Wade and says that the US Constitution no longer protects the right to abortion, here in Florida, the Florida Constitution, with its right to privacy, protects the right to abortion. And I wish I could end my story there, but there is unfortunately one more twist. And that is, just as the US Supreme Court has taken a sharp turn to the right, so has the Florida Supreme Court. So just as the US Supreme Court is reinterpreting federal law to really restrict access to abortion rights, it is entirely possible that the Florida Supreme Court will do the same thing to Florida's right to privacy and interpret it in a way that strips women of the protection that they currently enjoy. So, bottom line in Florida is that our Constitution does protect abortion. The current doctrine not only protects it vigorously, but there is a big question about whether or not the current Florida Supreme Court will leave that protection intact. And so that's my 4-minute summary of what the legal backdrop is to abortion in Florida.
Thank you, Caroline. And I will just take a moment to have everybody stop and think. If you have questions that you'd like to put in the Q&A now, even if they get answered, we can morph them. If you have legal questions that occur to you now, while anybody's speaking or when Deanna's speaking a little bit about history, I encourage you to put those, start getting those questions down so you don't forget. I also want to put a pin in how this organization, the Women's Fund, is not a political organization, but we do care about policy. So if you believe that the subjects that we're speaking about today don't have anything to do with partisan politics necessarily, they have to do with policies. It's really important for you to note that we will be continuing our ongoing trainings for Advocacy 101, how to advocate for what you believe in, and our next Impact Collaborative will be hybrid. So people will be able to tune in like this, but we can also meet in person and have ongoing training on how to influence and understand our different elected officials, how to influence them as well to get your voice heard. So with that little side commercial, I'll ask you to further enlighten us, Dion.
Sorry, I was muted. I didn't realize that. Thank you so much. So what I'm talking about today is tying into the larger issue of reproductive health, because some people are brushing off and saying this debate about abortion doesn't affect me. This debate about abortion has nothing to do with me. And I think that's important to sort of extend this discussion and also look at extending the discussion beyond at abortion, but also looking at it from an intersectional lens in terms of understanding how this affects people in different ways depending on your identity. So we're using this word reproductive health a lot. And when we're thinking about reproductive health, what we're really talking about is this state of, as they call it, complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity, but it's also about the reproductive systems and its function. So it's really looking at access and the biology of reproduction. And so we need to understand that it's beyond just about our reproductive functioning, or we call it the plumbing, but to also look at the ways in which this affects reproduction from a broader lens. And so one of the things I like to talk about when people tell me this has nothing to do with me, and if we just make abortion accessible, or if we stop abortion, it's going to fix things. If you're looking at the issues about maternal health, and I'm going to look at Black women, and I want to stress it's not, there are similar issues that relate to First Nation, Indigenous women, Latina women, etc. But I've chosen for this presentation from Black women. But we have two of the most popular Black women in the United States, Beyonce and Serena Williams, who both nearly died of complications from their pregnancies. And this picture, the other woman's picture, is Dr. Shalorn Irving. And she has 2 masters of PhD, and she was an epidemiologist at the Centers for Disease Control. And she died in childbirth. And as was brought up earlier, the reality is, as Black women, even with all the money in the world, and even if you have all the access in the world, Black women are dying at rates and suffering at rates worse than other groups. In fact, Black women across any economic or educational level are dying at rates during pregnancy, almost equal rates of women in the poorest areas of Brazil. In fact, the research has shown that a white woman in the United States with an 8th grade education is less likely to suffer complications during pregnancy than a Black woman with an advanced degree. And so this is not just simply about maternal deaths. There's also research done. Nancy Krieger at Harvard has found that Black women who lived during Jim Crow era, which is about discrimination in the Southern United States, supposedly ended through the mid-60s, but they have the highest rates of breast cancer. So they've been able to see through demographics that being born in a Jim Crow state increased your risk of being born with breast tumors. And I'll actually put the articles about these in the chat as soon as I'm finished, so if you can follow up on these. So it's clearly an issue that's not just about abortion and having children, but a larger factor, and its impacts on families, communities, and social levels. Because when women don't have access to abortions, or are forced to have a child, or they die during their death, it affects the mental health and has not just their mental health, but their community and their families, and has intergenerational complications. So what we have to start looking at this is in terms of the social systems that are happening here. So it's not just looking about voting, but we have to start looking about how does the systems in which we operate contribute to make life difficult for marginalized women, particularly Black women, et cetera, that affects their well-being and their inability to access quality reproductive health, or even have quality reproductive health. And so the research has shown that race is not a risk factor, economics is not a risk factor, but it's the lived experience of being a Black woman in this society around discrimination. That's something we're not talking about a lot when we're thinking about reproductive health, even in terms of abortion. So even if you have access to an abortion, what are the implications? Beyonce and Serena had access to the best healthcare, and they still had to fight for things that were going on. And it wasn't simply racism from the doctors at the site, but if you read the article, they talk about this concept of weathering, where people have experienced discrimination and have gone through a lot of chronic stress, are actually genetically responding in ways that make their health worse. Next slide. So what I really think is important is that we tease out the difference between reproductive justice and reproductive rights, which I've already said is even different than reproductive health. So reproductive rights infers that we have these privileges and benefits, and that we have liberty, autonomy, and equity. And we know that's not necessarily true. Reproductive justice, though, recognizes that women and girls' health is shaped by intersecting systemic oppressions, whether that's homophobia, race, classism, sexism, et cetera. And that affects their choices and the ways in which they experience systems. And so I think it's important that, and I appreciate that we talked about reproductive justice, because it merges social justice, human rights, and reproductive rights. It's not getting rid of reproductive rights, and really looks at the whole person, and not only women as ourselves, but our connectivity to our families and our communities. So what happens to me affects my family and affects my larger communities that I operate in. And I think this is part of the discussion that's really critical, that when we're talking about rights here, that it's not just us fighting for protecting laws, which is critical, but also looking at how we operate in systems and how the systems contribute to what's going on. And so I'm going to kind of end there and we can continue discussion. And I'm going to put the various articles that I cited for the research in the chat.
So expansive. Thank you, Dion. Also for everybody to know that our September Impact Collaborative, our health and well-being pillar, will go deeper into these, the Black maternal health. We're not the only ones who are talking about it. The Miami-Dade Commission for Women is looking at it. Esther and March of Dimes and others in the consortium and the Healthier Miami-Dade Consortium are looking at this, and we are stronger together. So please join us again and mark your calendars for the first Thursday in September to join us here as well. Diamond, please give us your insights. Thank you so much.
Ready, thank you. Thank you, Dion, for really laying out the definitions for us versus reproductive health, reproductive rights, and reproductive justice. And kind of what I wanted to talk about today was exactly that, because I remember we had a conversation while we were putting this panel together, and Women's Fund asked, what is a way that we can talk about choice, right? Like when we're talking about pro-choice, how do we highlight it? And Dion said this really amazing thing. Dion said choice with a question mark, right? Because we're talking about this not being a choice for some folk. When we're looking at the intersectional lens of reproductive justice, we're looking at all the intersections and all the avenues in which barriers and structures can come into place when you decide to have a child, right? As a queer Black woman, there's been many things that I've considered when it comes to giving birth to children. And I'm also thinking about the whole entire racist system of our gynecological, oh my God, y'all know the words that I'm talking about. Words are hard this morning, but the whole racist history of gynecology, and that the whole system that this is built on is off the exploitation and the experimentation of Black women's bodies throughout this movement. Reproductive control and reproductive oppression has always been about maintaining a white popular state and making sure that we define other folks who may look differently, live differently, are differently abled, are not able to define their parenthood. And when we're talking about this really narrow dichotomy of pro-choice versus pro-life, we really have to analyze the fact that for a lot of people of color, for a lot of women of color, for a lot of birthing people of color, we are still fighting for the right to parent, for the right to have our children. Thinking about the ways in which people who are under the incarcerated system are giving birth to babies in shackles, thinking about the way that there's a formula shortage, thinking about the ways in which Black people are witnessing the state violence on us all as a whole, right? Watching like Black bodies and Black lives not matter to some folk and watching our people die. This affects our ability to have children, to want children in the systems in which we live, right? So as we're saying, reproductive justice is not a replacement of reproductive health or a replacement of reproductive rights, but a way in which we can envision a new world together by making sure that we center the most marginalized and always moving that lens so that we can focus on having different conversations, different people's lived experiences into the conversation so that we can open it up and build a new world, right? We can't rely on the same things that have happened. We have seen how a pro-choice argument has directly come to the Hyde Amendment, in which the government was like, well, fine, if it is a choice, and if it's a private choice, then you need to privately fund this. Government medical care will not fund this. And we've seen the ways in which they treat us and the ways in which we can't have our children. So I guess my biggest request as like this whole thing is that we don't get tunnel vision and we don't think that it's only about abortion rights, because it's a lot bigger than that. White women will always have access to abortion. Middle-class women will always have access to abortion because they have the funds and the means to travel across state lines and to do different things. Whereas when we're talking about women of color, when we're talking about Indigenous women who also have the background of being forcibly sterilized by our systems, when we're talking about Latinx women and our birth control systems being built on testing birth controls and long-acting reproductive controls on people of color without their consent. We're talking about all of these things. So I just want to make sure that we keep that framework. I guess, and then going back to what Carolyn said, what is Planned Parenthood doing about this? Like she said, Florida has it written into our Constitution, the right to privacy, which is a broader approach than what's written into our Constitution for the United States. So Planned Parenthood Southeast North Florida, Planned Parenthood Southwest Central Florida, ACLU, Bread and Roses in Gainesville, and a few other plaintiffs, we are suing the state of Florida on the constitutionality of the 15-week ban that is proposed, and hoping that we can get that overturned before it goes into effect. And I guess my other call is like, while we're like making sure that we are spreading funds and knowledge, the biggest change comes not from only learning in these spaces, but actually inflicting change with the people that you have the most connections to, that interpersonal relationship. So take this knowledge and see, how am I applying this anti-racist framework, anti-capitalist framework to the people that I directly influence, and making sure that your money also matches that. Don't just give money to Planned Parenthood. Give money to the local abortion funds that are on the ground. Give money to the Black women on the ground who know firsthand how to combat intersecting forms of oppression. Follow the framework and do it, because it's kind of just like allyship. For me, you can't just show up and say, I'm an ally. I need to see it done and proven practice. That's how I define who an ally is. Let the community define you as that. And that's the same way that you should approach things when it comes to reproductive justice. Expand your framework, allow different voices into the room, and really sit back and learn and see where you can affect the most change. So that's all I have for you today.
Thanks so much, Diamond. Esther, please.
Hi, everyone. So I've been listening a lot to everyone so far. And when I think about what I want to share, I think about different lived experiences and stories that may spark some ideas and just some perspective on why it is that this could be such a tough issue to even address today. And so I could think of just one instance where my journey into this work actually was sparked by a threat to my reproductive rights to birth my way, right? And so back in 2014, I actually lived in Alabama, of all places. And that particular state has a rich history of not welcoming my community and who I am as a person. And so the laws therein really reflected that. I found myself realizing that my way, which was a way of birthing outside of the hospital setting with midwives and experiencing that with a doula, was not very feasible for folks living in Alabama at the time. The laws were such where the board and licensing rules only allowed specific types of midwives to practice, certified nurse midwives. And so that left me, a Haitian woman in Alabama, feeling very stuck, feeling like, okay, now I have to reinvent how I want to birth. And that should never have happened because of a law, because someone thought that a midwife wasn't trained enough to birth my baby unless there was an OB present too, right? And so what pregnancy was seen for me during my pregnancies was this period where I could get this undivided attention and care. And so the threat for me was knowing that my birthing experience could be very different than what I've experienced before. And so midwives have a tendency in a way about serving particularly women of color and low risk families with the care and attention that they deserve. And so I chose, right, to birth outside of Alabama, to travel 2.5 hours to another state. And these are like the desperate measures that we have to face, unfortunately, when we're trying to do something that we know in our heart of hearts, in our gut, in our intuition, this is what's best for us. And there is a framework that I utilize in childbirth education, and I always leave room for this particular component, which is the intuition. I cannot challenge or question that in a person. I have to be open and honest about what is leading someone to decide to choose this option versus the other. And so in this work, it's actually helped me pull back a lot of my biases, a lot of my, I guess, assumptions about why women have to make these choices. But at the end of the day, there's always that other side, right? What are we presenting to these birthing people as options, right? And when you think about the rights that are available to us, how do we learn of these rights? Right? Unless you're sitting in something like this, you're getting all this rich knowledge and information, but where are you gathering all of that information? And so it was professional development, it was doing this work. It's also listening to these women that I consult with prior to them booking or moving forward with me, and hearing the horror stories, hearing that they're not heard, hearing that they're afraid of dying. And that's a real reality. I had someone contact me 6 weeks pregnant, in tears, afraid, because of all of the news that they're seeing about Black women. They're afraid to give birth. And I can't question that. I can't make them unafraid. But at the very end of the day, I also feel my role is to present other opportunities and options to them as well. And so that might look like having a client reach out, say they want to move forward, and then weeks later decide, we need to have a conversation because now I feel like I want to have an abortion. It's taking the time to actively listen. What's going on? What is this perception of your reality that's making you get to this point? How can I assist you? What is the history behind this? What's contributing to you wanting to do this at this point? Because weeks ago you were excited. And this has really, really, truly happened. And it took some mental health support, right? We have to acknowledge it and don't assume that everyone's at this safe place mentally, spiritually, emotionally to make the decision to keep a baby, but also to make a decision to let it go. We have to also care for everyone holistically. And so in listening to her and seeing my scope, right, I was a little out of scope, and redirecting her to support, she was able to walk through that and decide to keep her baby and realize, I don't have to lose all my dreams and my hopes and things like that. So I'm about looking at both sides, but also acknowledging we have to also change the system. We can't just go one family at a time. We have to also address and dismantle these systems that make it so hard for us to make these choices. So definitely want to spend some time later on to talk about some solutions, but I just wanted to share my experience as a doula and how I've been able to help navigate that.
So rich, so much to think about from all of you. Thank you so much. Now, please do participate in the poll, you all, while Caroline takes us onto this next segment before the Q&A about, give us the fishing poles. What can we do? What are some options that you're seeing, Caroline?
So I'm here, I'm just talking about the law here, and the law is made by legislatures, governors, and judges. And so if you want to have different laws, you need to have different legislatures, different governors, and different judges. And so through the legal lens, what you need to do is get politically active. I know that's not the role of this particular gathering, but the solution that I see is Florida passed a law banning abortion at 15 weeks. It would not surprise me that the legislature will pass a law banning abortion at 6 weeks. Meanwhile, although abortion is very much in the news at the federal level, the Supreme Court may not only eliminate access to abortion, but contraception rights may be next on the chopping block for constitutional protection. So whether you want to get active at the federal level or whether you want to get active at the state level, we need people pressuring, well, I would say pressuring the current legislature, but I think that's futile. I think we need a new one. So a new legislature, a new governor who will veto laws or appoint different justices. Otherwise, we're going to see a continued rollback of our legal rights, which, as everyone acknowledged, is just the very first step. So regardless, it is quite clear that even with these available, not everybody has access to them, but if they're not available, then people definitely don't have access. So that's my pitch.
Thank you so much. Dion.
Yes, thank you. I think one of the, we always talk about education, and then which is great that this panel is doing this work. And I think it's not just about education, it's about literacy, because we can get education, but we need to move forward and start being able to think critically, because education depends on who's giving the knowledge. And I'm going to tell you right now, one of the things we just did a special issue on reproductive justice, and it was very hard to get people who do this work because it's not something that fits within the traditional realm of the ivory tower of academia. And also we do work that's about ourselves. And the reality is there's not a lot of representation. There's some about women, but fewer people of color who are in research positions. And that's a whole nother level. There's lots of faculty out that teach, but not as many are in the research positions, which is another example of institutional racism that is occurring. And so we have to start thinking about who's creating this knowledge that we're getting, what is their positionality, and what are they bringing to the table? And along with that is how we start learning. And then we have to start critically thinking, what is this knowledge and this history in? So it's also important to think about the history. What we're talking about right now with abortion rights, this didn't just drop today. This was being planned. And so we have to look at the whole history of Roe versus. A lot of, when I teach students, they are shocked when I said, your grandmothers might not have been able to get birth control. They had to get permission from their doctors. So it's important that we recognize and teach people that about the history of what was going on for years. Also, and the diverse histories. So birth control was great for wealthy white women, but it was created on the backs of women in Puerto Rico. It was created on the backs of women in India and Africa. So we have to talk about it holistically, and that's not to blame anybody, but it's to be critical thinkers and have literacy around it. And so I'm glad that this panel was really diverse, and you brought together people who do research, do law, who are actually on the ground. And that's the other piece, is that we have to have more centering of the voices of the people that we're talking about. We do a lot of talking about people, but we don't really do a lot of talking with and validating voices of the people who are living this and going through that. And I think that's really critical. So the other thing I'm always the queen of sending out is I'll put in the chat a list of foundational readings for reproductive justice that if you're really interested in, and this should help you have discussions. And then these are also discussions that we have to have with people who have different views, because what we find is that we all have the wrong information. And if we come together, we might not end up at the same point, but we're probably closer together than we think. And it's the people that are wanting to be divisive that are moving things forward. So I think the solution is having discussions like this at this macro level, but also doing it at an individual level and bringing in diverse voices like Women's Fund is doing here today. Thank you.
If we were in person, there would have been many rounds of applause. Diamond, you brought down the house for a while there. Dion, what you just said about we might not all come together to have the same opinion, but being closer together, I can hear the crowd going wild, because that's a really high impact truth. Diamond, you want to bring down the house again? Here you go. What can we do?
No, everybody has shared some really amazing pieces. I'm going to have to piggyback on Dion again and just say that it's time to have hard conversations, and it's time to have honest conversations. And that includes, like Dion said, telling the full story of the reproductive movement and understanding that although reproductive justice was coined in 1994 by 12 Black women, it is a framework that really can transform the way that we do things and the way that we approach people. And so with that, when we did polling to talk about our messaging at Planned Parenthood, we found through the voice of people that pro-choice and pro-life, those terms alone kind of just turn people off. But that also gives us an opportunity to have more of these nuanced conversations where we're bringing these diverse stories into light. And like I said, let's not get tunnel vision, because all of this has to do with reproductive justice. We're talking about climate. We're talking about the prison industrial complex. We're talking about a whole lot of things that you should also care about. Don't just come out with your hangers and pink pussy hats for this one important cause and then die out after that, right? This is a fight that we can do together, and that the more that we center other people's lived expressions and things like that, lived identities, we can do a lot more. And because when the most marginalized is free, then we're all free. And how, like, what a world that'll be that we can imagine, you know? Expanding language, because language is important when you're talking about this. Make sure you're bringing trans people into the conversation. It's not only women that can give birth, these are birthing people, these are birthing folk, and that is a whole vast array of folks. So that's all I have. And pressure your legislators, of course. I know as people of color, we've seen like how our vote can be used against us or not like validated, but make sure that we hold these folks accountable, get the people in that we want. Like, this is our house.
Bold, broad vision, right? A community where we can all truly thrive. And it's not tunnel vision. That is absolutely brilliant. I hope we all, that's going to be one of my reconfirming takeaways for today. Thank you, Diamond. And Esther, calls to action. What can we do?
Definitely, definitely. And I do want to kind of frame this call to action with this in mind. You know, there were times where, you know, I had 2 under 2 or 3 children under 3. And, you know, so I'm living in the thick of it, not really getting that balance in between and getting that break to even explore what's important. But at the end of the day, what's important to me is making sure that folks in similar situations, whether you're living paycheck to paycheck, whether you have support from a partner or not, whether you have family support or not, whether you live in the best neighborhood or the worst neighborhood, is to make sure that they all have support and equal access to the things that they need for their families to thrive. And so the top 3 solutions I can think of right now is, number 1, please stop touching our options. Don't omit, don't neglect to share resources. And I see this a lot, right? Because we have different nonprofits, different organizations, and they often work in silos. They don't work together, right? And they come across things all the time, flyers about this event and, you know, free resources to share with their, you know, clients and audience, and they don't share. And so if there's anything that you can do, utilize your platform, right? And share those options. And I'm also talking to those who might be healthcare providers, right? Be thorough, be clear about all of our options. When we're sitting in that waiting room and getting care from you, right? Don't be shy to talk to us and tell us what's really going on in our bodies. Don't rush us. Right? Don't force us to have quick conversations and not get into the thick of why we feel the way we feel. Because underlying that, I promise, it could be stress. It could be a lot of different things that if we don't have documentation of this, right, in our records, it becomes a bigger problem later when someone does decide to want to reproduce, okay? Secondly, I want people to give us spaces to elevate our voices, to actually talk, to be heard, to receive the care that we need. We need to learn how to listen better. We need to learn how to pause for a second and not feel the need to have to defend ourselves right away, but just pause and just listen to another human being, right? And just share what's happening. And that's what I have to do as a doula. And that's why doulas are so integral to the solution. And so the third thing I would say is definitely fund those initiatives and those programs that are creating the solutions. Right. So I will tell you this, Metro Mommy Agency, I'm committed to it. We're at the crux of it here in Miami-Dade County when it comes to maternal child health. And I'm working to increase access to doulas for those who especially can't afford it, who need Medicaid to cover the cost for their doula care, right? Because now we know there's expanded benefits and Medicaid can cover that cost. And I'm not doing this work alone, right? So I invite you to join me during these Healthy Baby Task Force meetings where we have other stakeholders. You can find your club of folks who think like you, who want to be a part of the solution. And then we also have the Jasmine Project Community Action Network, and we meet every other month. We'll be meeting in June. So definitely reach out, stay connected. I think it's a 365-day thing for me, right, to do this work. And so I think if folks can commit to just, you know, a 30-day challenge, right, of sorts, to just really pour into this when you leave this collaborative, to just spend some time and find out which schedules work best and attend and show up and show up with your voices. And that's what I would just say, and stay connected. I'm happy to hear from you all. And thank you again for allowing me to be a part of this.
So Elizabeth, we're going to ask you to join us for this Q&A portion. And let me say that you started us off with people raising their hands about, being frustrated, being sad, being shocked. I think one thing we all know, because all of you who are here today are people who show up. So whether it's Cindy Lerner and they're one of the students that we have in here, one of the service providers, you're all folks who show up. And so we know that the best cure or anecdote, at least, or best medicine for frustration and anger is to take something and do something. So whoever's spoken most, clearly with you, one or two or three of the panelists and some of these calls to action, that is definitely the best cure. I want to offer to you all that Viviana, I'm going to ask you to post in the chat the resources that we have. Viviana in our research department has put together. Thank you, Deborah. We've got over 140 organizations that do support women and girls in our community, and that's a resource, that's a living, breathing guide. Please not only go there and look at it, but I'm sure you'll find others who should be joining us there. And Viviana, you can put your email in there as well. So if anybody sees any updates or suggestions to that resource, that would be terrific. Also, Esther, also responding to what you just talked about, resources, and to what you talked about, Diamond, about really looking at larger health issues as well. We also, I mentioned before, this effects of extreme heat and climate change. We have a specific campaign on how it's affecting pregnant people. And Vivi, I ask you to share that information as well. Please spread it all to all of our networks. Can't remember which one of our brilliant panelists talked about how we learn. We get research from people that we trust. And there are a lot of trustworthy people here today in the audience, in addition to the panelists. So please take the facts, take the resources, and share them with folks. So I'm going to do the first question, and that comes directly for you, Diamond, from one of our board members, Priscilla Dames. Diamond, please discuss being an ally versus real allyship.
Yeah, I'll do my best. So basically, the difference is kind of just in performance, right? I think things become trends, and sometimes it's really popular to look woke, to look in the now, to post a Black square, but actually you are calling cops on Black folks in your neighborhood, like that type of thing of duality, right? So I think when it comes to allyship, it is about what you are doing in your everyday life to contribute to anti-racist practices or whatever practices, right? Anti-capitalistic practices, wherever you're trying to be an ally to. And that has a criteria and the way that you move things, right? It's not just about what you're posting on social media or just joining conversations about and getting knowledge, right? And just co-opting knowledge, or just inviting Black women to speak somewhere, but not actually having foundations into their own movements. I think we have to really take a in-depth look at what it means to be a resource to people and to use your privilege to get them into places. Are you paying Black folk, people of color, disabled folks, people with different abilities? Is your room diverse? Are you actually truly, instead of just listening, are you implementing? Are you operating from a place of transformative justice where you're not just being defensive, you're actually willing to learn and see how you have been impacting things and what you can do to the steps of accountability, right? A lot of people will be like, oh, I didn't know, and that's fine. No, you have to do the work after that. It's a consistent learning thing. It's a consistent doing thing. And it's not about the dramatics of it all, the glamour of it all, the looks of it all. I just personally operate from the framework, like I said, I don't trust people who just come in and say, I'm an ally. I want to see it proven. I shouldn't have to question it. If I have to question it, if it's a question, then you're not doing the work.
Anybody else want to jump in on that question or go to the next? Okay, I think you covered it, Diamond. So Deborah Dietz, thanks for your question. She says first that she loves all the discussions and perspectives today. I wonder where women with disabilities fit into your messages. They also have a long history of facing the same issues and concerns and are also commonly still left out of the conversations. You touched on that briefly, Diamond. Would somebody else like to take that?
Yeah, this is Dion. Can I jump in? I think it's really critical that one thing that I see happening a lot is this divisive, and so I think I didn't articulate it properly. But when we're talking about intersectional identities, that would be part of it. And a lot of times we're not thinking about women with disabilities. Some are visible that we can see and some are invisible. And so I think that goes to a larger lens of intersectionality. So that's why it's not just race, it's not just economics, it is having differing abilities, national identity, religion, all of those things that make up who we are as individuals. So I think it's important that we start naming it, as it's been said by the person in this chat. But my other piece where I get nervous is because often when I go to workshops, people will say, well, what about Latinos? What about this? And it is exactly true. There are very different experiences across the board. I think this is why it's important to look at things from a justice lens, because it's really about, okay, let's bring it so that everybody is at the table or is sitting there and has access. And that's one of the issues that we don't have. So I think all the things that everybody's talked about here could be said about women with disabilities, but also a woman with a disability who is First Nations, who is transgender, who has all these other identities well within there. So I do agree that that needs to be articulated and put sitting at the forefront with everyone else. But it's also important that we frame it within an intersectional lens, that there are shared oppressions across all groups that are important to consider, and not just think that it's only about Black women like I've presented today.
Thank you so much. Anybody else? Esther, you?
Yeah, I'd like to share also, when we think about how women of color are able to give birth here and the different complications that can happen, it can sometimes lead to things like morbidities, right? That also would put them now in this category of different disabilities that they'll experience as well. And so we have to be cautious and mindful of that the care that they're receiving prior to them even giving birth or even becoming pregnant is just as important as well. So just wanted to highlight that.
Important. Caroline, this one might be for you, but please, everybody else, feel free to take it as well. Cindy Lerner saying, don't forget about the pregnant teens who have additional barriers, including parental consent laws, which requires that they go to court to get a judicial waiver if they can't go to their parents. Do you have any insights for us, Caroline, on Florida?
Well, yeah, so although the right to privacy does cover minors as well, minors have a right to privacy. And in fact, the decision of the Florida Supreme Court holding that right to privacy covers abortion involved a minor and a law, and it actually struck down a law requiring parental consent. Unfortunately, it triggered a backlash, and our Constitution was amended to allow the state to pass a law requiring parental notification, I should say. There's a difference. There's parental notification and parental consent. So the Florida Constitution now explicitly allows the state to require parental notification. And as soon as that became part of our Constitution, that also became part of the law. I think the legislature went one step further. Let's be clear, it's feeling very emboldened now, and I think we should expect to see more and more attempts to restrict whatever rights are remaining, and pass a parental notification law. And I think that is in the process of being litigated. I'm not quite, honestly, I don't know off the top of my hand the status of that, but now to be clear, as you said, the teen who cannot get their parents on board can go to a court, and if the court deems them either mature enough to make a decision about whether or not to have an abortion, then they can allow to have that. Or if the court deems it in their best interest to have an abortion, even if they are not mature, then the court will noblesse grant permission. Of course, this whole regime is ridiculous because it is really only an obstacle for teens. It serves no useful purpose. Because in what world would it not be in the teen's best interest to end a pregnancy she does not want? And so I cannot even imagine being a teenager, discovering I'm pregnant, and living with parents who would never in a million years allow an abortion, and then have to figure out how to find a lawyer, how to go to court, how to go through this incredibly complicated process, all while dealing with being pregnant. That's a longer answer than perhaps you wanted, but it's really part and parcel of so many laws that are really, they're often described as protecting teens or protecting women, but of course they're nothing of the kind. They're just laws trying to make it harder for women to control their own body and control their own destiny.
Thank you so much. We have another question here about when the news comes out. There's imminent change. Elizabeth, maybe you can take this one first, and then would love to hear everybody who's got something to say. What are people thinking might be most efficacious ways to react? What are the short, medium, and long-term actions? We've talked a lot about, people being reactive all the time, and what are you seeing on a national level? Elizabeth, if you'll start, and then love everybody to chime in.
Yeah, I think the number one, it's important to remember that we still, it hasn't happened yet. We still have legal abortion in every state in the country. So it's important to remember that and hold on to that. But I think, thinking a little bit about what the world is going to look like most likely is important. And I think the number one thing is, coming from the, we're in women's philanthropy, right? And gender equity philanthropy. Why we are here in 2022 has a lot to do about the choices that the movements have made due to, responsible for their own choices, but a lot of it has been driven by funding scarcity. When there's scarcity, the impulse to break off and to prioritize some needs over others is really high, and it's a natural inclination. And the strategy to starve this movement, knowing full well that legal abortion was completely under attack from the beginning, also knowing that there was that schism of legal abortion versus access versus justice. That's the opposition capitalized on that, and the idea of this movement being starved for resources over the past 50 years is very real. Is a reality as to why we're here today. And so when thinking about what we can do immediately, number one, fund your abortion funds. There's abortion funds. There's a national network of abortion funds where you can find a local abortion fund that will help the immediate life changing aspect of helping individual people who are pregnant access an abortion that they want. So that's number one, the immediate need, because those people can't wait years or however long it might take. So that's number one. Number two is really thinking about this is a local battle. This is now moved from a national perspective, national perspective, and a global organization. We are really energized by the fact that the global community is looking at the United States and wants to help. all of those different wins that we talked about, those people are reaching out to WFN, to the members here, to Miami, to Texas, and saying, how can we help? And so I would say join your local women's fund, the Miami-Dade, so wherever you're at, join your local women's fund who are helping move resources to on the ground advocacy, organizing, grassroots organizing, your local abortion fund. They're thinking about different ways to move capital as well, to fund some of these fights. So I would say, you know, I mean, again, this is coming from the perspective of this movement has been starved for resources. Let's not do that again. If we really want a different outcome, we need to prioritize funding both to the individual women who are going to be needing those resources at the national, so those abortion funds, and also to philanthropic organizers like the Miami-Dade Women's Fund, who are aggregating resources to help deploy them to grassroots organizations.
I see. Caroline.
Yeah, I would echo that. So when the Supreme Court does eliminate the right to abortion and the fate of that becomes up to the states, half the states are going to ban abortion. And they're going to be almost all the states in the South. And Florida will be one of the few states that will still have abortion available. And so we are going to be a bit of a mecca for women, not just in Florida, but for all the neighboring states. And so what really is needed is funds to help those women find their way down here where they can still get a legal abortion. So I would say the abortion funds are going to be in need of both resources of all kinds. And I say that especially to get women here. And it has to be done efficiently and quickly, because even here, we may have a 15-week ban. We may not. I don't know what the Florida Supreme Court will ultimately do, but it's going to take some time for that law to actually go in effect. I guess I'm assuming it's going to be enjoined, but at least there will be some access here, and it's going to be the only place for millions of women.
Thank you, Caroline. Deanna, I saw you nodding. Did you have a comment on this?
No, I'm sorry. I'm just listening to it. It's terrifying. That's what my point is. Sorry. I mean, it's important we talk about it, but it's actually very terrifying.
There was a question here. Cindy also asked, Women's Emergency Network here locally is one of the organizations that works with abortion access. Does anybody have other, other resources to share in organizations to support? Diamond, did you alluded to helping to fund grassroots orgs?
Yeah, there's a couple. I would say, in addition to Metro Mommy Agency here in Miami, we do have Southern Birth Justice Network. You can send your funds to them if you're interested. There's also Dignity Power, who's fighting for the to help with Diamond's Ford case, which is another no-knock warrant case that happened similar to Breonna Taylor. Mackenzie Project, which is here in Miami as well, Black trans-led organization trying to collect funds to do a drop-in center in Liberty City for trans folk. If you're also local to Liberty City, we have a free urgent care clinic that the Healing and Justice Center did, which provides free urgent care for folks in Liberty City, which is also sponsored by Build Black Men and some other folks. So just like, yeah, look on the ground. Those are just a couple. And also I wanted to add to Caroline's point where we're talking about the 15-week abortion ban and them also passing other restrictions. They do things like we have a 24-hour waiting period, which means like you have to forcibly, when you go in to get an abortion, they'll make you wait 24 hours to reconsider your decision and think about if it's truly a decision that you want to make. But that also does not constitute actually 24 hours, especially in our clinics like Planned Parenthood. Our providers are only there once a week. So that 24 hours actually turns into a really long time. And if we're looking at Florida becoming a safe haven for abortion, that's also making sure that people have funds for childcare, because they're going to also be missing out on work. We're talking about a trip from maybe like North Carolina or Texas all the way here that will literally have somebody out of work for about 2 to 3 weeks to get care, things that they don't do to other medical procedures. So just wanted to expand the thoughts on that.
Terrific. Really important question. Actually, one of our staff, Camila, who many of you know, who's very much an activist throughout her whole life. Help us. How can we work to end abortion stigma and talk to people about, words that have been hijacked from us to people who feel differently? Talk about agency and autonomy and respect of medical professionals and individuals to make those decisions together. Who wants to start? I know you've all got something good.
I think one of the most successful changes of opinion have surrounded the LGBT community. And I think a lot of that was traced to people coming out. Because when everyone gay, or not everyone, when large numbers of people who were gay came out, everyone realized that someone they cherished was gay. And I think that if we could do the same thing with abortion, it will soon become immediately apparent that everybody knows many people who have had to end a pregnancy one way or another. So I think that's one thing. And another thing is, I think the framing of it as basic healthcare should also continue. I don't know if that will have the same emotional punch, but I think it is the appropriate framing. And so those are my 2 suggestions, to have to just talk about it like as necessary healthcare for women. But also for women who have had abortions, just to talk about it and say, yeah, it was not a big deal. I was 18 and I was about to go to college, and, or I wanted to be pregnant, but it wasn't going to survive. And so I think that might be effective.
Awesome. Elizabeth. Oh, I thought I saw you unmuted, but I guess I don't. There we go.
But I would definitely echo all that, and just point to research, communication research has been done, and we've seen be very effective around the idea that first off, talking about choice is not as effective as Diamond mentioned. That doesn't resonate for many communities. But talking about support, that whether or not you personally would get an abortion, that you would support somebody who somebody you knew who made that choice for themselves. And the idea around that, I think, is going back to what Carolyn said. When they can put themselves in a place of, if I knew someone who I cared about who had had an abortion or needed to make a choice around that, we found that the majority of people, men, women, all folks would support that they would support someone they knew if they felt that the decision to an abortion was best for them. They would support them regardless of how they felt about the issue. And so I think, really analyzing it in that way really puts it into a place where a conversation can be had.
I also think one of the concerns is that we're also going back to larger lenses. There's also a big pushback from religions. Like there's all this cultural messaging around abortion. And this is something that's a shift. I'm from Canada, where abortions are there, but nobody goes to treat it as birth control. But there's not the same stigma. It's covered by the government. People go to the Morgentaler Clinic. I've accompanied people there. And so there's a really different cultural lens around that. And when we started having protesters in Toronto, they were brought in from America. So it was interesting. That's about the culture. It doesn't mean you're pro-abortion. And I think that's one of the issues that we have to think about is it's also not just about abortion, but what are the cultural messages about abortion? So one is starting to work with churches, and we're not going to change some churches, but we can have discussions, but also change it around discussion about women's sexuality. A lot of this is about controlling women's sexuality. Like, you're a fallen woman, you have to have this abortion. This is it. We're not talking about vasectomies for men. And so there's a dynamic going on here that this is also a gendered narrative around women's sexuality that's broader. And I think when you start talking about it in that way, it sort of shifts the lens. So I think we have to have discussions that just don't focus on the rights and wrongs of the abortion, but what are we talking about really? And I think when we start talking in this way, people can be less fixated on you're murdering a baby narrative, et cetera, to start focusing on this is about health. It's not, and it's about sexuality. It's not about sex and punishing, but also getting to the gendered piece that is central to this discussion.
That's brilliant. It is almost 10:30. Catholics for Choice, I will say, has got some great messaging, somewhere I've learned from quite a bit. I want to say that this has been recorded, and within 24 hours, this session will be available both on the Women's Fund Miami-Dade YouTube, and if you go to and Viv, go ahead and put it on there, the direct link to our Impact Collaborative tab on our website. So all of these issues that we address every month are there. Please feel free to utilize, to do showings of these portions. Priscilla talked about it. We need to take these to our organizations and our spheres of influence. If something that Diamond said really struck a note with you, something legal that Caroline shared, the history that Dion, Esther's stories, something that Elizabeth said, you can use those in pieces to give back up to your conversations, or to spark conversations. And that's locally, and that's nationally as well. We've got a lot of people in the education system here with us today. Please, these resources are to be shared. If you come back often, you'll see the intersectionality of how, life is messy, and that's supposed to be, because we're a complex and brilliant human race, right? And so if leadership and health and well-being and economic mobility and freedom from violence are pillars that you think can support a woman and a girl and all the people who identify in any way in our community to help them truly thrive, you're going to find those cutting edge conversations here and the experts. So this is your Women's Fund. Please keep on joining us, and cannot say enough that we need to learn to advocate no matter what our opinions are. So this time next month, we're actually going to meet in person again at Miami-Dade College Wolfson. And those of you who have to join virtually, that's fine as well. But we're going to have a real working session with a real expert. So please join us stronger together. Thank you all so much for being here, panelists. Everybody unmute. Thank you.
Bye, everybody. Thank you so much.
Simon, thank you so much. We'll all keep in touch. Thank you, Esther.
Esther.
We'll talk to you any minute.
Bye.